All right. Hello, everyone. It's an honor to be speaking with you today and in such remarkable company. So today I'm going to be presenting some joint work with my incredible co-authors, Diego Alburez-Gutierrez, Iván Williams, and Emilio Zagheni. And this is very much work in progress, so we would absolutely appreciate any feedback that you might have. So I'll start a bit with what we know at first. So we know that in many countries, the COVID-19 pandemic has been associated with increases in mortality above expected levels. We know that many of these excess deaths are concentrated at older ages. And we also know that for all these excess deaths, this will mean excess bereavement, more individuals experiencing the loss of a relative. And we do have some recent estimates of what this might mean in the US context. Verdry et al. Find that for every death directly attributable to COVID-19, that's associated with 9 close kin potentially experiencing bereavement. And that is for direct COVID deaths alone. And this is significant because losing kin is associated with potentially significant long-term impacts on mental and physical health, as well as other measures of well-being. However, what we don't know quite as well is how the experience of these excess deaths will be distributed from the perspective of those who might survive the pandemic, but who will experience the deaths of one or more relatives associated with these increases in excess mortality. And how is this experienced from their perspective? And which age groups or sects are most likely to be affected? And how does this vary by country? And this is important for better understanding sort of the long-term consequences of the pandemic on individuals and their kin networks. And that is what we study in this paper. So to study this concept, we look at 2 related quantities. One of them is the probability of losing a relative for those who have one at the start of the period. And this is useful for sort of thinking about the distribution of the experience of bereavement. And the other concept that we think about is the number of relatives lost during a period, sort of the mean difference in number of relatives surviving, basically. And this is useful for thinking about the magnitude of bereavement as experienced in a network. And both of these are measured compared to a counterfactual scenario without COVID-19 excess mortality. And these are measured for the average person who survives the period, who I'm going to refer to as ego here, in keeping with sort of the literature on kinship. And in order to quantify this difference compared to this counterfactual scenario, what we do is we use demographic microsimulation to get estimates for these 2 scenarios. And for the demographic microsimulation, we use SOCSIM, which is a platform developed at Berkeley that generates population genealogies for a set of individuals given a set of vital rates for a period of time. So what we do is we use these rates, and then we generate these genealogies, and then we identify the individuals that we're interested in, we identify their kin networks, and then we identify the bereavement they might be experiencing at various points in time. And since these simulations are stochastic, we run 100 simulations per country and per scenario to count for this. And today I'll be reporting results for just 16 European countries and the United States, so just 17 countries. And I'm going to be using monthly vital rates since SOCSIM works on a monthly basis. For fertility rates and for non-COVID mortality, we just use the 5-year UN WPP rates and all medium variants, basically. And for the COVID-19 rates, what we do is we adjust the UN WPP rates for March to June 2020. So we're only considering the first wave. So this is very much a lower bound on bereavement, given what we've seen in subsequent COVID-19 mortality. And this is something that we intend to work on expanding as we continue on with this work. But in any case, in order to make this adjustment, what we do is we use ratios of observed to expected mortality rates that we calculate from the HMD's short-term mortality fluctuations data set. And that's a new data source that emerged this year that provides weekly all-cause death totals disaggregated by age and sex for at least the past few years for a number of countries. And to calculate this, we use a 4-year average for expected mortality. And this is obviously one possible model for expected mortality. We're working on considering others, but it has been used in some of the excess mortality literature thus far. And in this slide, you can see just an example of the sort of factors we're using to calculate the rates that go into SOCSM for Spain, for example. And so now I think after presenting some of these methods, it's time to move into some summary statistics and results. And I had discussed earlier the two measures of bereavement that we're interested in, one of them being probability of loss and the other being expected number of kin lost. And we are interested in two main dimensions of variation in these measures. One of them is variation within a population by age and sex of the egos, and the other is variation across countries. And looking at the distribution of kin on these dimensions is important for getting a summary idea of how excess mortality might affect the distribution of kin loss. And we see in this first slide that averaged across all countries and scenarios, what percentage of individuals in various age groups here might have at least one relative of a certain type before the start of the period of interest. So this is February 2020. And as we would expect, younger individuals, which are sort of the darker bars, would have more relatives alive in older generations, and vice versa for older individuals, which are the lighter bars. And this means that we would predict that an increase in old age mortality would have a generational effect essentially on bereavement, with older individuals more likely to be losing kin from the same generation, and younger individuals losing relatives from older generations. And I don't present sex disaggregated results here because they are relatively similar. So going into results, this is the excess probability of losing a relative in the COVID-19 scenario, the first quantity that we were interested in. And we can see this generational effect very clearly. First of all, we see that this is sort of just an absolute percentage point difference in the probability of losing a relative across these two scenarios, adjusted by the distribution of kin. And what we see is, first of all, these are all positive numbers. So excess mortality would be expected to increase the probability of losing a relative, which makes sense because it's just an increase in mortality rates. And the second thing that we see is this generational effect. We see that the biggest increases in probability of losing kin are occurring for individuals who are losing grandparents, essentially. And this is experienced by individuals primarily who are under 65. Meanwhile, the individuals who are above 65 are more likely to be seeing their losses occurring in the same generation, or potentially one generation above them in the case of parents. And in the case of when they're losing individuals in the same generation, the probability of losing kin are much higher than other age groups in such a case. And we see a very, very similar story for excess number of kin lost, which is just the same. It's just the difference in between the means and then multiplied by the distribution, essentially. And we see that these generational effects persist. We see also that these numbers are quite low and actually quite similar to what we would expect, what we saw previously. And a big function of this is the biological limit on the sort of relatives that we're looking at here. You can only have 2 parents, for example. You can only have 4 biological grandparents of this age. So this is very much constrained by that. But what we do see that is interesting is just that even a very short mortality increase, I mean, we're only considering a few months here ultimately, does potentially result in an impact on people's kin networks. And this is something to consider. And now finally, we've seen something about how the expected effects of mortality might work across a population distribution of relatives, but how would this look at on a cross-country level, which is something that we're interested in because these countries have different levels of excess mortality and they also have different age and sex structures. And the first thing that we notice is this confirms what we saw previously with the positive relationship between excess mortality and excess bereavement, because we do see a positive relationship in these graphs, especially for for grandparents and parents, and to some extent siblings as well. We don't see this for children, which is sort of the generational effect we might expect, and it makes sense given the age distributions of the countries that we're looking at. And we see that that the slope is much more steep for older generations like grandparents than it is for children. And what we're interested in thinking about going forward is, to what extent is this driven by the levels of excess mortality that we're seeing across different countries? And to what extent is this just driven by the age distribution of countries and the age distribution of relatives? And that's something that we intend to be thinking about more carefully going forward. And as we consider these very partial results, I think it's important to realize that there are many limitations that we're working on as well, but that are certainly worth considering. And one of them is that we have a fairly small sample of countries here. We are only considering 17 countries in these slides, and we intend to expand this, but it's important to realize that the countries for whom excess mortality data may be available may not be representative of the global population at all. So we might expect very different results in other countries. So that's something to consider. Another thing that's important to consider is that COVID-19 cases are often clustered. So, and that we might expect that mortality might be clustered as a result, but however, we're assuming that there's a uniform distribution of excess mortality across the population, which is obviously not what we would necessarily expect. And this actually, what this does mean is that these numbers, these very low numbers that we see earlier, might actually be a lot higher for those who are experiencing bereavement if mortality was clustered. And this is a common problem in demographic microsimulation, but it's worth noting here. Finally, another important thing to consider is that these results are for survivors, and excess mortality may alter the distribution of who survives and alter the networks of those who survive. And we don't notice that that's a major issue, but it's something to consider. And going forward, we intend to address some of these issues as well. One of them is expanding the list of countries, months, and types of kin covered. Another thing that we're going to be doing is disentangling the effects of mortality and age structure on bereavement by decomposition modeling, sort of modeling the extent to which this relationship is shaped by age structure and the extent to which it's shaped by mortality levels. And finally, another thing we're planning on doing is robustness checks using Caswell's matrix approach to the Goodman-Kiefert's kinship equations to calculate sort of expected kin under various mortality scenarios. And an additional robustness check that's built into that is that we're using different data sources for the mortality and fertility rates. So we're hoping that that will allow for a useful kind of cross-check for our simulation output, essentially.
4 minutes.
Sounds great, thank you. So these results give us basically these results are giving us a sense of the relationship between excess mortality and the experience of bereavement. They're giving us a sense of the distribution of such loss and how that might vary across the population. They also sort of point to the importance of considering both age structure of a population and the excess mortality in shaping this relationship. And finally, it's important, and we can use these results and the results that are still in progress and so on to get a better idea of how excess mortality may affect the experience of bereavement in these countries and how it may affect the experience of bereavement in other countries and contexts. And this will be useful for sort of predicting the long-term consequences of the pandemic and its impact on those who survive. So this is still very much work in progress. We would very much appreciate any questions, comments, or feedback, so please do get in touch. And thank you so much for your time and for being a great audience.